I wasn't able to do that.
I know.
Too much.
I know.
Yeah. Wow. Can I try that again?
Of course.
Try that again.
So tell me exactly what's going on.
Well, I'm getting a lot of lower back pain.
Lower back pain?
Especially on the left side.
Okay.
And I get the, for some reason, this used to be a bad side. But now, this right here, I'm starting to have some really bad pain right here.
So your left leg used to be bad, now your right leg is hurting you?
The whole left side, the whole left side.
It's just be so bad?
Yeah, even from my head all the way to my feet, you know what I'm saying?
Very severe pain?
Yes, very severe pain. Some dangerous pain, make me scared sometimes.
Gotcha.
And then I catch a panic attack sometimes. Then I get the lightning pain all through my body.
Lightning pain all throughout your body? No lower back, just the front of the torso area, you get lightning pain all around?
Yeah, all around my arms, my neck, my chest.
Can you kind of tell me in relationship with the surgery, please?
Okay, the first surgery that I had with the laminectomy in 2015, 4 months later, that's when I started feeling more pain. And I started feeling my back, my spine was moving like this.
Yes.
Yeah, and so every time I go like this, I click, click, click. I go like this, click, click, click. I said, I know that's not normal. I'm saying I never heard that before. My back would pop it 3 times, click, 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 click. And so I went and see another doctor. And the doctor told me, he said, look, you might need another surgery because your spine is moving, it's not stable. So we're gonna have to fuse this together and make sure you're okay.
I also want to be able to ask you the pain in your leg. Has it been gotten worse, better, or the same since the second spinal surgery?
It gotten worse. It gets really stiff, and then it's hard to walk. I gotta walk like stiff like that. I'm saying, you know, and it's gotten worse definitely with the second surgery. You know? So
it almost sounds like to me that you have overall body pain.
Yeah. That's
getting worse.
Yes.
And that it's becoming to a point that you cannot really articulate, you cannot even describe what your pain feels like. So it's kind of being hard to for you to just kind of pinpoint what's hurting, what's not.
Yeah, you know, like I said, the main thing is, the main thing of pain now is my foot.
Yes.
Right here, that's the main thing. And the second thing is my neck.
So foot pain and neck pain after after your spinal surgery.
Yeah.
That's the foot pain. How does the pain coming along from your body? How does it come? Show me exactly. Show me the map.
Okay. It comes from the lower back, and I feel it through here. Mm-hmm. And here recently, I'm starting to feel a lot of weakness right here and this right here. A lot of weakness, a lot of tingling, and a lot of throbbing pain. Especially when I walk. Okay. Especially in the morning time, and when I do too much walking, I feel, you know, all the way from up here, it's like a nagging pain.
Gotcha.
Yeah.
So you get pain on the right side of the thigh.
Yes.
And then you'll get a pain. You get pain right here, but now this is more painful. Yes.
Yeah. This right leg is more painful.
Go ahead and walk for me, please. You already know something's not right.
Yeah.
Turn around. Walk. Difficult, I can already tell. You get foot pain right now?
Turn
around?
Not really.
Okay.
Just I feel it right here. I feel
the right side?
Yeah. And I feel it right here. It's like a lot of tension right here.
Okay, go ahead and walk for me, please. So tension on the back and the tension on the right side, yes?
Yes.
Okay, turn around. And then we'll compare afterwards.
Okay.
Walk for me, please. So one thing I do notice is your entire right side is actually very, very tight. Very, very tight. Obviously, I see the scars that you had for your spinal surgery. I see that it had healed properly and things like this. But I see there's a lot of stiffness on this side and the stiffness on this right side. You might be saying that, okay, I had this for many, many years, so that's normal to me.
Yes.
But I wanted to let you know, any times, it does not matter. Your back, your spine, your leg. If you have a lot of tension on your body,
yes,
that means something's not stable. Muscles trying to work overtime to stabilize something that is not stable.
Okay.
So what it might be, that's exactly what I'm here to find out. Does that make sense to you, sir?
Yes, sir.
So I'm going to go ahead and run my instrument on you. And then I'm going through the area where you had surgery. But guess what?
Yes.
I found the most amount of problems on the areas where you did not have surgery. Right here, in your tailbone.
Okay.
I found the most amount of problem in your tailbone area.
Yes.
5, sacral number 5, 4, 3. You feel this, right?
Yes. Oh. Yeah, I felt that. Yeah.
That's your tailbone. It's not supposed to be moving like this. It's supposed to be one single fused bone on you, but it's not.
Yeah.
This is your 5. This is your L5. This is your backbone that you had a fusion surgery on. But that's okay. 4 is okay too. So stiff. But yet again, this is that almost makes you jump. So this is you looking from front to back.
Okay.
This is your head. This is your pelvis. This is you looking from side to side. Okay? Without me saying anything, without me saying much about it, what do you notice about your spine that is different?
It looks like it's crooked.
Yes, it is actually crooked.
Holy crap.
It's actually leaning toward more to the left side. You see that from, this is where you had your surgery, you can see the metals over here, the things that your doctor has put it on. But you see how everything's kind of leaning toward the right side here like this, but your body's trying to catch it, so that it's actually trying to bring it up to right here.
Yeah.
So you might be asking, is that the reason why I'm actually having a lot of pain? You might be asking that question. Just like the ground floor of a building is a foundation. You know that if you build a house, you have to build a foundation. You have to pour concrete to be able to make some kind of sturdy foundation so you can build a house. Look at it this way, you're about 6 feet tall.
Yes, 5'11" and a half.
5'11" and a half. That's very specific. Let's just say you're 6 feet. Okay, you are 6 feet tall. So you do also have a foundation as a structure. Your structural foundation is not your foot. As a foot doctor, I like to say it's a foot, but it's not. Your structural foundation actually is your pelvis. Pelvis. Right here is your structural foundation. That's exactly where I found your problem. That's exactly where you said a lot of, ouch, that really, really hurts. That's the one that you actually said it. Right here. Your surgery, L4 and L5, you have fused disc. There's nothing I can do, anybody can do, and nobody should be touching this area because it's already fused and you don't want the hardware to move. There's some kind of trauma that actually have major tailbone to be in such a drastic angle. Does this look like this?
No.
It does not.
No.
So if nobody addresses this, I don't care if they put metals here, I don't care if they put gold or diamonds or silver, it's not gonna work. Why? Because they still haven't addressed the entire problems right here. By me fixing this problem, I can do 2 things. Number 1, normalize the relationship of the bones right here, which means that you are actually having a lot of pressures going to your L4 and L5. Why? Because your bone is not stable. This is actually unstable to begin with now because you had surgery. Now it's even more unstable because your foundation is unable to support those 2 bones. So this is going to be my game plan. My number 1 game plan is I'm going to be treating your tailbone first. After treating your tailbone, I'm going to make it to walk around. If I am correct, if what I'm saying is correct, your leg pain will subside significantly after the 1 tailbone treatment. Drop more, completely drop. I know this is kind of difficult with your surgery, but try to get your belly as much as down as possible for me, please. Let it down. Let it down, let it down, let it down, let it down. Let it down more. Let it down more. Let it down more. 0 to 100%, how much improvement do you feel?
I said 20%.
20%.
Yeah, it just feels really tight. You know what I'm saying? No?
Gotcha.
It was when I was walking the first time. It was a lot of pain right here, but I don't feel it.
You don't feel the pain on your legs anymore.
No, I just feel it in my back now.
Okay.
I just feel it in my back.
Right. So the leg pains are gone then.
I don't feel that problem I have right here too much.
Yeah. Wonderful. That's exactly what we're looking for. No leg pain.
Oh, neck.
Look at the neck. I adjusted your tailbone. How's your neck now?
It's not as bad as it was before.
Look at that. You know, you had a hard time standing up. You remember that?
Yeah.
Go ahead and stand up for me, please. Oh, look at that.
Oh, shit. I'm doing it.
You couldn't get up as easily.
Yeah, it's a little better. Yeah, a little better.
Because you had a hard time.
Yes.
Okay. Okay, get up now. Sit up now. Look at that.
Holy crap. Wow.
Holy crap is right.
Holy shit. Let me try that again.
You like it?
Holy shit, yeah. I wasn't able to do that.
I know.
Too much.
I know.
Yeah. Wow. Can I try that again?
Of course.
Try that again. Okay. Wow. Okay.
So your pain still might be there because remember you had surgery. It's not going to be as immediate. But me taking care of that tailbone, didn't touch your surgical area, just me taking care of one tailbone. How's that now? You see the differences now?
Yeah, I feel it. I don't feel too much pain when I stand up.
Okay.
You know what I'm saying?
Now, yeah.
It feels much better though, to be honest. Yeah.
After surgery, it's going to take some time for us to be able to recover. Walk around for me, please. You came with a cane, but you're not walking with cane.
Okay.
Feels nice, yes?
Yes.
All right. This is Dr. Lee. Let's get the obvious out of the way. Before the treatment, he was using a cane and barely walking. But after the treatment, after one single tailbone treatment, he's walking normally without any problems. Before the treatment, he did not have any hip swing side to side, but after treatment, he has arm swing as well as a hip movement side to side. Notice how his body was tilted to the left side before the treatment, but he does not have any body tilt after the treatment. This is the power of total body approaches to your foot and ankle and back pain. Thank you.